So now this is our rotator cuff tendon that's torn and the bone here. So normally we'd come in through one of these portals, being a keyhole, so this little shaver and burr will go down. That will clean off the bone area there and make it bleed, because the aim of our repair is to get this tendon to heal down to the bone. So you need blood because that has nutrition. So the burr's gone down, and now Naomi's my office assistant, but today she's getting to operate, which is hopefully a lot of fun for her. So Naomi, if you could just hold this guide here. We'll get rid of the portal actually, just to make it easier for today. So you hold that with the handle, and we're going to drill a hole in the bone through here, and everything's all measured. And now this is our anchor that we're going to put down into the bone. So that goes down here. That's the wrong size. It's the pink one. That's why it's really important to have a good assistant, because they give you all the right equipment. So we'll put that back over there. And this will slide down through here into the hole. And now Naomi is going to use her mallet and tap that down all the way. Harder, harder, harder. That's it. Stop. And now we just pull that out, which is really cool. And then the stitches are in the bone here. You can see that those stitches have been implanted in the bone, and we actually tug on that, and that's really strong. You can see that that won't come out now. Okay, thank you. So now we'll move on to the next step, where we get the sutures, and we're going to feed it through this little special needle, and then we're going to come back in to the shoulder. We're going to deploy that needle through the tendon, and it puts the stitches through there, and we can pull that out. And this is a repetitive process here, where we're looking through the camera, feeding the needle through the rotator cuff and the stitches. You can see there that we've got the sutures here through the rotator cuff. And now, if you just hold that nice and firm, thanks Naomi, we're going to stitch that back down. So this is a special process where we're using what's called a knot pusher. So that feeds through there. And I'm going to throw a special knot. So, because we're doing all this outside the skin and sending it down through the shoulder. So anyone who likes tying knots, or maybe done scouts previously, that would be a handy skill. So this is a special knot that slides down. So you can see I'm just pulling one side of it, and it slides all the way down to the tendon there, and it's going to cinch it really nice and firm. And then I've got a special knot pusher that's going to push it down even further and snug it down. And I'll hold it there and then pull the other limb, and that's going to tighten it off, and it won't be able to come loose. You can see how strong that is there. So that's the first part. We'll repeat that process just so I can show you. The main technique I use is what's called a double row repair, which there's lots of YouTube videos on. So we'll just quickly do that on the other side. And so what we're going to do now, this is what's called the double row. We've got a special second little device, which is not actually the one for this repair, but it should all fit. So all these stitches go through the end of this special anchor. It's all these little, it's like threading a little needle. Okay, so we've threaded all those. The wrong way today. Okay. So what we're going to just do quickly, let's drill another little hole. And now this is going to go there. I'll probably do this one because it's from my side. So you can see as I'm tapping this anchor down, it's actually really tightening the tendon down to the bone. And then we take off this for the second part. And we remove the anchor there, and that's the final result of our repair. So you can see the tendons snug down to the bone, and it's kind of got this crisscross pattern pushing it all down.